Hi, and welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we come to you every Wednesday as veterinarians and technicians in general practice to get you to the point where you are the best you can be in general practice dentistry. 5 episodes, we're going to be transitioning to pain management, and we're honored to have Dr. Mark Epstein, veterinary pain management expert, medical director at Total Bond Veterinary Hospitals in North Carolina, and a certified veterinary pain practitioner to join us here. He's a diplomat and past president of the American Board of Veterinary Practitioners and a past president of the International Veterinary Academy of Pain Management. Dr. Epstein also co chaired the AHA and AAFP pain management guidelines, led the AHA Senior Care Guidelines Task Force, and was awarded the 2022 Vitica Small Animal Educator of the Year Award at the Western Veterinary Conference. So Dr. Epstein recorded these in a live workshop back in 2023, so they're all very recent. All 5 episodes are categorized based on the agent. They are brief for a reason because there's a lot of information in each one. So please sit back and enjoy Dr. Mark Epstein.
All right, which brings us to a nerve growth factor and the new therapeutic we have in cats, Salencia, and in dogs, Librella. So just keeping in mind that this particular slide shows what happens with tissue damage, and you get all these inflammatory mediators or cells, and they release their mediators. And that goes afferently up to the dorsal horn of the spinal cord, where the first order neuron synapse is there, second order neuron up to the brain. All that is afferent. But you'll notice that there are some of these arrows here that are backwards, and you can see that something is wrong, if you will, that things are going in the wrong direction, not just afferent, but efferent. Prostaglandin, that's our COX inhibiting NSAIDs, but also galoprant as it binds to EP4. And then NGF is the new one. It binds to the TrkA receptor, and it does its action at this kind of backward arrow part. Let's just unpack that a little bit. So NGF binds to TrkA in the periphery, and that particular molecule now, that combination molecule, gets opsonized into the cytoplasm of the neuron. It then traffics up to the dorsal root ganglion, and the signaling continues on to the synapse in the dorsal root of the spinal cord, which then projects to the brain. So that is where we get some of this signaling afferently all the way up to the brain for pain. The problem is with NGF is that once it reaches that dorsal root ganglion, this is where the efferent activity starts. And that efferent kind of antidromic opposite traveling of signaling, when it reaches back down to the periphery, you can see it causes the release of substance P and CGRP. This attracts mast cells and neutrophils, causes them to degranulate, and they release all of their pro-inflammatory, pro-nociceptive mediators, and it just begins to amplify the problem by creating more inflammation that we call neurogenic inflammation. So it's not the original inflammation, if you will, it's this amplified neurogenic from this antidromic pain processing to which NGF is largely responsible. So because of that, it's been a target as a therapeutic for all these years. I've said this before, but just to make sure we're on the same page, NGF, nerve growth factor, we have it as a fetus, we have it as an infant, all the way up into adulthood as we develop our peripheral central nervous system. Then it downregulates and it performs some kind of basal functions, percolating very much below the surface. But then at sites of chronic inflammation, for example, in the joints, it upregulates again and creates the phenomenon that we just discussed. You can see the chart or the little graph at the bottom where there's much more of it in these particular patients in the synovial fluid of dogs with OA. So looking at a pain product for it, it was investigated in humans for a long time, and it worked, but in patients, especially if they were getting high doses and they were getting NSAIDs, there was an increase, an uptick of a phenomenon called rapidly progressing osteoarthritis or osteonecrosis. Now, I'm going to talk more about this, but this is a recognized condition in people. It can happen idiopathically. It can happen after joint injections, even people just taking NSAIDs. But here in these studies, there was more of it in people taking NSAIDs getting the higher dose of anti-NGF monoclonal antibody. So the studies were stopped, then the studies were started again, but they were used only the lower dose and no NSAIDs were allowed in the study. And the FDA declined to approve it in 2021. I will come back to that in just a minute. What about in veterinary medicine? We've had Salencia, and most of you have been using Salencia already, these monthly sub-Q injections, and you probably have seen something like this. So here's a kitty creeping up the stairs, and this is zooming down the stairs and zooming up the stairs. So that's pretty typical of the responses that we have seen, and probably you have as well. I do have some open questions about it. I may have mentioned this already, but let me just go back through it. Salencia seems a few things popping up on the AD list are alopecia and pruritus, not just at the injection site either, but maybe over larger parts of the dorsal cervical area, maybe other places as well. And why and how that is happening is really not known. It's not common, but it is something that is, I think, coming up into the pharmacovigilance data. And in Librella, because it's been out in Europe for 2.5 years, that there are a few things, one thing really popping up on that radar, and that's, it says PUPD here on the slide, but it's really PDPU. It's a primary polydipsia. Now, it's really rare. It's 1 out of every 10,000 dogs. And about half of them, if you stop with Librella, that resolves. The other half, it doesn't seem to. This is of unknown origin. We don't know. Duration of effect, it's labeled for 4 weeks. Will we be able to, schedule it out and go to 5 and 6 and 7 weeks in intervals? Maybe, probably, actually, just based on effects on what we know about other monoclonal antibody therapeutics. Sustainability. Most of these products are of murine origin. They've got little mouse antigen. So the possibility of creating anti-drug antibody is there. Interestingly, for both Librella and for Salencia, they are looking for these molecules, have yet to find them. Now, Salencia is a murine-based molecule. It's been felinized, but the canine product, Librella, is not. It's strictly a canine product. So again, just an open question to be made. And then we have this kind of question about the NSAIDs, which I'm going to cover in just a minute. And we have the idea about what if there's CNS or peripheral nervous system injury. Now, normally, this is a huge molecule, these anti-nerve growth factor monoclonal antibodies, and they do not cross in the blood-brain barrier. The NGF is also responsible for central sensitization in addition to peripheral. Maybe there's a benefit if it could get in, but maybe if there's damage to the spinal cord, let's say intervertebral disc disease, might it prevent the body from being able to help it to repair itself? The blood-brain barrier is known to get more permeable over time. Obviously, it can become permeable with some kind of injury itself. So it's an open question about what to do with comorbid neurologic disease, and that's just something we're going to have to play out over time. What about NSAIDs? Let's go ahead and cover what we know about that RPOA in people and in dogs and cats. As I said, it happens normally in people or rarely, but it's spontaneously and then secondary to the things you see here. And what about in dogs? Because dogs and cats, this is not established as a phenomenon in either species. So we would never, the FDA didn't, and we would not have expected it to be a consideration or a concern on our end. And it isn't. So the label on these products say basically it has not been studied. These products have not been studied in a way to determine if there's a problem co-administering it with NSAIDs. We're not expecting it. The question about what we're going to do with regarding the NSAIDs is an open one. And in my head, there's two different buckets. First of all, are a lot of the dogs we're going to start off with, we're going to contact our owners. They're on all this stuff. They're still struggling with the multimodal therapies they're already on, NSAIDs and everything else. And we're going to use Librella in them. Now, what do we do about the NSAIDs in these dogs? And I don't know, but I'm going to read the tea leaves. I think probably on some dogs, we might be able to withdraw the NSAID. On some dogs, we won't be able to withdraw the NSAID at all. They require both to maintain or maximize their mobility and quality of life. Some dogs will probably be able to reduce the NSAID, but not withdraw it. Give it intermittently, PRN, pulse dose, week on, week off, go to every second or third day. I don't know. I'm, again, suspecting we'll probably have a little bit of a bell curve about it, but we're all going to be learning that together. The second bucket of dogs is okay. They come in and they're stage 2, let's say, or co-stage 2, maybe stage 3, and you're going to start something. What are you going to start with? The Librella, or are you going to start with NSAIDs? Are you going to do both? So that's a whole nother discussion to have. I will remind you that Librella it reduces peripheral sensitization and neurogenic inflammation. It does not address the kind of underlying irregular or original inflammatory process of degenerative joint disease and osteoarthritis. Only NSAIDs will do that. So I think there will always be a role for NSAIDs. And when it comes down to which one, unfortunately, these guidelines that I was referencing earlier doesn't say. It basically says pick one. And together, we're going to have to figure out how we should be navigating that in the coming years. So stay tuned for that.
I really hope you enjoyed that episode. If you are a veterinarian and you want to be one of the best in dentistry in general practice and take your team to that level as well, the Veterinary Dental Practitioner Program can get you there. Please visit IVDI.org and put in an application today, and hopefully we'll see you soon in the future in our meetings and in our virtual extraction wet labs. We'll see you next week.